Tenzo Kench, few studies discuss the possibility of infection through sexual intercourse. Have you come across any study about the possibility of spread? So I have. So one over here, this is not a study, but this is Mayo Clinic. Sexual intercourse and the spread. So look, in sexual contact, of course, there are touching each other's surfaces, touching other surfaces nearby, touching skin, kissing, saliva exchange. Then intercourse has semen and the vaginal secretions. Then anal sphincters are nearby as well, and the fecal matter may be present in all of this. And then maybe having sex might cause sweating as well. So in all of this, the areas of transmission are still the same, and that is respiratory system. That means oropharyngeal respiratory system. That means oropharyngeal area is a risk area. So if a person is shedding, then they will be shedding from these areas. But sweating would not do anything. The wounds will not do anything. Injuries will not do anything. Similarly, semen doesn't have the virus. Vaginal secretions do not have the virus. However, because fecal matter contains the virus, that means external anal sphincter will have the virus as well if it is not properly cleaned. And if during the sexual activity one comes in contact with the fecal route, then it is possible that if, for example, hand is touched and then that hand goes to your mouth, or there are some sexual methods as well where fecal route is also, or the anal canal is also used. In that case, it is possible that one would come in contact with the fecal matter. If that is the case, then the virus can be transmitted. And please remember that orophycal route is possible with coronaviruses, and the fecal material can contain coronaviruses up to 2 months after the symptoms have resolved. So the intercourse itself is not going to cause the transmission, but all the activity which then leads to nasopharyngeal areas exposure, or the fecal materials exposure, or the surfaces that are nearby, if they have viruses, that can cause the transmission.